should say.
Hi, welcome to our Building Community Check-In today. I'm Sharon Knight. I'm President and CEO of Hope Communities, a nonprofit that provides housing, educational programs, and support services, and has done that for 40 years. We are so happy to bring these shows to you, and oftentimes we bring area experts to provide some essential information for our viewers, and today I will be very pleased to present Mark Kling, who is with the Family Resource Center Association. We're going to talk a little bit about family resilience today during quarantine, and we're really going to start about, how can people get information and resources they need to help keep their families safe. And we're going to be focusing on those family resources across Denver right now, even though Family Resource Center Association works across the state. So I know that many people watch this show after we post it live. So if you hear anything today that you think we should share or you should share with any of your colleagues, please do that. I'm sure Mark is going to share a lot of great information that families will really want to hear later on. And so please forward this link to the show. Also, if you or any of your associates have a need for resources or have questions, need support, please feel free to email us at info@hopecommunities.org and we'll get right back to you. So a little bit of news today. More than 2,000 people have gotten tested for COVID-19 in the first 10 days of operation at that free testing site we told you about at the Aurora Sports Center. It is a really great new addition to the other site, which was at Water World and of course the Pepsi Center. And so these are part of the state's efforts to make sure that everybody gets tested. And so part of that is to help keep people safe, to get treatment as soon as possible, and part of it is for tracking so that we can then track and see who else has been around people who've gotten the virus. So there's a new term circulating, you've probably heard it, it's called the twindemic, and that is something that public health officials are concerned about in terms of having COVID-19 pandemic along with the flu season. So they're really stressing that we should get flu shots this year, even if you haven't gotten them before, because the double whammy of both of those things could be very challenging for families. So a quote from Dr. Benefla says, "Getting a flu shot even this early is far better than not getting a flu shot at all." And in fact, King Soopers announced that it's going to be offering COVID-19 testing, and of course they also already have flu shots available. So you might want to check that out to make sure that you can get tested for both of those things. We want you to be very healthy. I have a couple of quotes for today. The first one is by John McCain. "Every day people serve their neighbors and our nation in many different ways, from helping a child learn and easing the loneliness of those without family to defending our freedom overseas. It is in this spirit of dedication to others and to our country that I believe service should be broadly and deeply encouraged." And we certainly do too. We are so impressed with how people have been helping their friends and neighbors during the pandemic, and hopefully we can keep that going on. And families are under a lot of stress right now, and we are concerned about the effect of that stress on well-being, which is what's going to help lead us to this show, and also to one more quote by Rudolfo Anaya. "The tragic consequences of life can be overcome by the magical strength that resides in the human heart." So I am kind of a softie about people helping each other and about organizations helping each other. And so I'm really pleased today to have this conversation with you and with Mark Kling. Mark is Executive Director of the Family Resource Center Association, and we will post the link to that website for you. He's been there for 13 years, which in itself is a feat. He previously served as General Counsel for Space Imaging Incorporated, as well as other corporate positions, conducting business nationwide and in fact in over 20 countries. We're so glad to have him on our show.
Thank you.
Thank you. So Mark, can you please tell us a little bit about the Family Resource Center Association?
Yes, the Family Resource Center association is a true association. We have 32 member family resource centers throughout the state of Colorado, and we support them and do work on their behalf so that they can be strong in their own communities to work with primarily low-income families to help those low-income families improve self-reliance. We offer multiple services for them, including referrals out to agencies if we don't do that actual work ourselves. And our mission is to ensure that our member family resource centers throughout the state are strong and optimally equipped to serve Colorado families. And we do that by making sure that we help them with capacity building and technical assistance so they have the best tools. We also advocate on their behalf at the statewide level and at the national level. We do resource development and fundraise for them and pass through quite a bit of funding for family resource centers throughout the state. And we also do peer learning, giving them opportunities to get together and share best practices as to what works best with families. And then finally, we offer evaluation tools so that we can look and see what's working best and continue to improve our model and how we do our work with families so that we help families in the best way possible.
Great, great. Some people may know this, but what exactly is a family resource center, and are they all the same?
They are not all the same. They're all separate organizations. They have different types of models. Primarily, the great majority of them are separate 501c3 nonprofit organizations, but two of them are embedded in school districts. One of them is with an early childhood council down in the southwestern part of the state. And we also have one that is in a county department of social services. So they can take different forms, but they truly reflect their community, but they use best statewide and national practices to do their work at the local level.
And they're trying to provide resources for families, whatever they need, or are there certain areas?
A key way in which we do our work is to actually talk to the family, find out what the families want, find out what the families need, and then help provide the referrals that they might need or actually do the work within the community themselves. We will have the family undertake what we call the an assessment, which is an assessment in 14 different areas showing where their strengths are, where they might have some weaknesses, where they might need additional help that we can help provide to them.
The CFSA.
The CFSA, yes.
Yeah, awesome. So I know you have centers across the whole state, but what are some in Denver that some of our viewers might be able to get support from?
We have 8 in the Denver metro area. One is Aurora Community Connection out in Aurora. We have one called Broomfield Fish up in Broomfield in Boulder County, or actually Broomfield County now. We have the Center for African American Health, which is kind of in the northeast part of Metro Denver. We have the Denver Indian Family Resource Center located here in Denver. We have the Emergency Family Assistance Association up in Boulder County. We also have Families Forward Resource Center in Green Valley Ranch and other parts of northeast Denver. Also Focus Points Family Resource Center, which is located in the Globeville area and does a lot of work in North Denver. And then we have the Our Center in Longmont up in Boulder County.
So each of those probably have their own website, and
Yes.
people could go to those to figure out what resources would be available?
Yes, they all have their own website. They can be contacted directly to see what the services they have available. And a key part of our model is making sure that our family development workers that work directly with the families, that if our center doesn't offer the service they need, these family development workers are experts in the field and can help the family find the resources they need in the community that might be able to help them, and then hopefully give that family a warm handoff.
Yeah, that's similar to what we do. We have a lot of services on site, but there are a lot of referrals because
Right.
we all can't do everything well, so we've got to leverage all of those partnerships. Was there anything else about services and resources that stands out about any of the centers that you might want to talk about?
Well, they truly reflect their community. So depending on what they think is the most necessary services in the community, that's typically what they try to offer. And we try to offer a good blend of both emergency services for when families are in some type of crisis, but also try to do a lot of prevention work so that families are building on their strengths, becoming stronger over time, and eventually won't need those types of emergency services.
Building self-reliance.
Yes.
So can anybody access services from a community resource center, or do they need a family resource center? Do they need some kind of special insurance or some kind of special entree?
No, it's open to anybody who walks through the door or who might call or look for them on the internet. And we welcome everybody, and there are no costs involved. Very rarely there might be a minimal cost for a service, but that's somewhat unusual, and nor is insurance required.
Okay, awesome. So have you noticed some big changes in needs during this pandemic period?
Yes, particularly early on, we had a massive influx of people needing emergency services, things like rental assistance, things like food assistance, those types of services, employment assistance to get a job if they lost their job. And we look at ourselves as doing a lot of prevention work to help families so that they don't need emergency services. But at a time like this, many of our partners want us to help them provide those emergency services to families. And that fits in very well with us because we are a network and because we network with other organizations. We saw a lot of providers coming to us and saying, we need to get out, let's say, the State Department of Human Services, for instance, said, we need to get out diapers and wipes and other materials to families quickly. Can we utilize your network to do that? So we'll work with agencies like that to really get the services out throughout the community that's needed. And a lot of that happened and is still happening as a result of the pandemic.
It's amazing how something that sounds simple, like diapers, can be a really big issue. They were short of supply, they're pretty expensive, especially if you've lost your job.
Right.
So, great resource.
Yeah, and it's nice to know that our partners look at us that way, and that when times do get tough, they turn to us to help them implement those types of regional and statewide services.
That's great. Yeah, partnerships are huge. They're really important.
Like the ones that we have.
I know. So I was looking on your website,
Mhm.
and I happened to see a page under the resource tab about tips and ideas, which looked really cool. Can you tell us a little bit about that?
Yeah, that's a part of our website where we wanted to have the average user access some what we might consider to be best practices and other documents. So those tips and ideas include many short documents. You would click on different things like depression or fatherhood or child exercises or family activities that families can do together. And so you can just click on a button on the screen to find out more about whatever issue you're interested in, and a short document will pop up giving some what we think are best practices in how to make sure families stay healthy.
Yeah, I loved it. It was really good information. I really encourage everyone to go there. Again, we'll put the website on there with that specific link so you can get to that page. It was really great. So, other information you'd like to share about the association or about Family Resource Centers?
Not really, other than just come and see us. You know, if you have questions, our family development workers are a very good resource for you to contact us and find out what other resources exist in your community, including at the Family Resource Center or elsewhere, to determine how we can best serve your family and how the community can best serve your family.
Great. Well, thank you so much for being here.
You're
It's
welcome.
great to get this information.
Thanks for having me.
You are welcome. Well, as part of every Facebook event, we do like to share a book review because we know a lot of people are spending more time at home and a lot of people are reading more. And so we've gotten reviews from different community members, staff, volunteers that we work with, and we try as much as possible to get books that are downloadable from the Denver Public Library or another public library because we know it's hard for some people to get out, and the library still are only doing curbside pickup. So I will share a review with you in a second, but I want to also remind you that if you want to do a book review for us, please let me know. Reach out to us at info@hopecommunities.org. I'd love to talk with you more about that. So we want to get reviews of all different kinds of books from all different kinds of people. So let me know if you want to do it. Today's book review is offered to us by Stephanie Villaforte, and she is the Child Protection Ombudsman for the state of Colorado. Stephanie is reviewing a book called The Orphan Train by Christine Baker-Klein. I don't know if you've read it. It's a really great book. In essence, the book looks between 1854 and 1929. There was a program that used what they called orphan trains that ran from cities in the East Coast to the farmlands of the Midwest. And they carried thousands of abandoned children who really their fates would be determined by sheer luck. I mean, they could be adopted by a really kind and loving family, or they might face hard labor and servitude. So Christina Baker-Klein tells the story of historical significance, really, through the eyes of two different people, and it's a masterful book. I really appreciate Stephanie giving us this review. It'll be posted in just a few minutes, and please look at it. Consider reading the book. It is available at the Denver Public Library, but not yet for download. So hopefully you can get that through curbside. Or, of course, you could visit one of our small bookstores around the town and support somebody else in their small business. So that's our show for today. We will be back on Tuesday, and we hope you'll join us. And before I go, I would be remiss if I didn't remind people that we do have our first ever virtual Hope for the Future event that will be posted live for everyone on Thursday morning, the 27th at 8:30. So hopefully you'll join us there. And if you have any questions, if you need any support, if you would like to offer resources to us to share with others, please email us at info@hopecommunities.org. Bye now. Thanks so much for joining our show.